We're referring back to this article in Time magazine 20 years ago on the secret killer, a surprising link between inflammation and heart attacks, cancer, Alzheimer's, and the diseases. And just in the last year in Time magazine, they had another article very similar. Inflammation may be the culprit behind our deadliest diseases. Talks about it again. And we know it's there. The link is there. All you got to do is clean your diet up and eat junk food and see what you feel like the next day. That's active inflammation. So we look at this in general. All right, it says the link between inflammation and blood glucose. There are certain factors you look at. See, because I do a lot of cross-referencing, a lot of reading, and I say there's certain things we can look at in a normal blood test to determine if that person actually has active inflammation. One of them is triglycerides. The other one is low HDL. In fact, it says high triglycerides, so high levels of blood triglycerides trigger chronic inflammation. Much of the focus on blood lipid levels is on cholesterol. As higher levels of cholesterol mean higher levels of oxidized cholesterol that cause atherosclerosis, the formation of fatty lesions that narrow and weaken blood vessels. Methods of lowering cholesterol can slow the progression of atherosclerosis to some degree and reduce the risk of consequent stroke or heart attack occurring when an atherosclerotic lesion ruptures. That's the vulnerable plaque. Researchers here look and say at consequences of high triglyceride levels in blood, uncovering a mechanism by which this provokes chronic inflammation. Chronic inflammation drives the progression of all of the common conditions of aging. Atherosclerosis included. Ways to lower cholesterol should also be an area of interest. And that's tied to blood sugar. That's why diabetics, type 2, they are in an active state of inflammation, of chronic inflammation. And that's why that increases your risk, type 2 diabetes, of developing all types of cancers and Alzheimer's, heart disease, kidney failure. Here's one for you. The link between inflammation and blood glucose. Now, when I say blood glucose, I mean anything above 90. The relationship between blood glucose and inflammation is complex but interesting. We're sure already have a ton of questions about it. Does inflammation raise insulin? Is there a link to diabetes, like an increased risk of developing it? And if you don't already know enough about inflammation, there are many reasons why you should. For starters, people with diabetes or prediabetes could benefit from learning more about it, since inflammatory molecules can directly affect how your body processes sugars and fats. And there's helpful information here for non-diabetic people too. After all, knowing more about these things like immune responses, the markers of inflammation, and the links between insulin resistance and inflammation can help optimize your health. Research shows that inflammation plays a vital role in regulating blood glucose levels. When scientists first made this discovery, it led to things like anti-inflammatory drugs that target the immune system and treat type 2 diabetes. Today, we know more about how these medications work, and we're able to better control blood glucose levels with them than we were in the past. Learning more about inflammation and blood glucose will also help you learn how to minimize your risk of cardiovascular disease, high blood pressure, heart disease, and cholesterol. It says here, inflammation is a natural process. It's commonly thought of as the body's response to viruses, infections, and injuries. It's your body attempting to defeat a threat, and it's usually a good thing. Without inflammation, even simple ailments can cause damage, but this protects your body from harm under normal conditions. Types of inflammation. Acute inflammation. This is short term. This is something that happens right now. Chronic inflammation. That's long term. When you have chronic inflammation, it's usually tied to lifestyle, inflammation, and blood glucose levels. The link between inflammation and blood glucose are complex, and research is still ongoing. However, there is a clear link between high glucose and diabetes with elevated inflammatory markers. When we talk about diabetes and prediabetes, it's easy to only think about high blood sugar levels, but inflammation also affects our cells. It makes them insulin resistant, leading to chronically elevated blood sugar levels, and chronically elevated blood insulin levels. Inflammation is often called a silent condition. That means it can develop unnoticed over time, contributing to chronic disease like type 2 diabetes. In a nutshell, when you eat foods high in carbohydrates, you trigger an inflammatory response. This is why some experts raise concern about diets that are high in processed foods. This can lead to inflammation-related issues like obesity, heart disease, cancer, diabetes, and Alzheimer's, and even depression. So it's this inflammatory response. Your body is actually causing things to get worse because you're not making things get better, and that's lifestyle control. But the problem with the medical community, it's never, ever, or very seldom ever discussed by your doctor. When you go in and you've got the conditions I mentioned in my show here, these chronic diseases, elevated blood sugar, elevated blood pressure, high cholesterol, high triglycerides, over 90, and last week over 60 when damage starts to happen to the LDL particle. Alzheimer's. It's never discussed on changing your diet to become anti-inflammatory. And when all the evidence is pointing now in the direction of a keto diet in treatment of these diseases, and particularly mental health. And this is new stuff from NPR. Mental health and the keto diet. They're scrambling like crazy. In fact, Harvard is doing some open research right now on these neurological disorders and the keto diet because they've seen such great results with it. And in some medical schools are actually using it to treat cancer. But you don't hear enough about it. Mainstream media doesn't talk about this. These are inflammatory diseases caused from lifestyle. And a way to change inflammation, to reverse it or slow it down, is change what you're doing to cause it in the first place. No one promises forever youth, that you're going to live forever. But you can slow the processes of aging down by controlling inflammation. And that's lifestyle in nature. Diet, exercise, sleep, lack of stress, a good social life, be around people. That's extremely important. We're designed, God made us to be social, to be community, to be together. We're not meant to be all by ourselves. So if you're trying to reverse the processes of aging and inflammation and chronic disease, get these things under control. First step today, ladies and gentlemen who are listening to me, clean your diet up. Push your old-fashioned beliefs that we got to eat, less fat, we got to eat less meat, we have to eat more starchy foods, more carbohydrates. Push it aside. That's bad information. Bring back into play our ancestral diet, which is a little higher fat intake, but good fats. Good protein, much lower carbohydrate intake. In fact, anthropologists will tell you that our ancestors maybe ate once or twice a day, not 3, 4, 5, or 6. They didn't snack. They didn't graze. We're not rudimentary animals. We're omnivores. Once or twice a day, sometimes days without eating. That's why you can go 5 weeks without food and not have a problem, not die. 5 days without water, and about 3 to 5 minutes without air. So what's that tell you? What's important? Oxygen, water, food down the road. You don't need to be eating every day. That's also why it shows the intermittent fasting also is very, very helpful in taking inflammation down too as well and reversing chronic diseases because you're eating less food, particularly less carbohydrates in the diet. This is all lifestyle.